Occupational health is the interaction between work and health. So performing artists encounter an enormous range of health hazards in the workplace, and a lot of these are in common with other occupational sectors, so things like sound exposure, light exposure, travel and touring, but some others are really unique to the performing artists. In occupational health, we like to look at a holistic perspective. So that starts from when the performer leaves their home to attend work, and that might include carrying equipment or carrying instruments. So occupational health takes a very systematic approach to identifying hazards to health, and these are categorised into physical, chemical, biological, ergonomic, psychosocial and safety hazards. So physical hazards include sound exposure, there's light exposure, so think about working in a theatre where there may be glare or there may be darkness. We also have people working outdoors, which can give a range of different temperatures that people may need to work at. Some examples then of chemical hazards would be where performers use makeup or wig glue. And indeed think about the other people in the sector, so the people who actually make the wigs or put on the makeup and the costumes. Biological hazards, especially when travelling and touring, so you may need some vaccinations if you were going to certain parts of the world. Ergonomic hazards tend to be the most well recognised, and that's problems with posture, so using asymmetrical instruments. Thinking about dancing or performing in a circus, we'll have lots of different postures, and these can be static or dynamic. Psychosocial stressors will include things like travelling and touring, which will require time away from family and loved ones. There are many well-recognised financial stressors associated with the performing arts, where we see a lot of freelance workers who have to balance the demands of the creative side of their work with the need to earn a living. Working at unsocial hours can also lead to some isolation, and performing anxiety is well recognised. It's a type of social anxiety and also known as stage fright. Safety hazards then are frequently seen in musical theatre and circus, for instance, where performers can work at height, they can work with fire and with stage weaponry. So as an occupational health doctor, I would always use a system called the hierarchy of controls. And this is a transferable evidence-based system that allows me to present a range of options to limit the risk of harm from any activity. This begins with consideration of elimination of the exposure to the recognised hazard. Of course, this may not be possible depending on the activity that we're doing. So the next step would be substitution. So a good example here would be if there is a sort of makeup that is causing a skin condition in a performer, we would look at whether there is an alternative style of makeup that we can use. Engineering controls can include sophisticated sound treatment systems that are installed in theatres, as well as sprung floors seen in dance studios, which can help to minimise injuries in dancers. Moving on to management controls then, this is about changing how people work. So you may wish to look carefully at a rehearsal schedule and plan for any break times. You can also look at how people are spaced within that rehearsal and see if there's any changes you can make to the formation and the duration of rehearsal to minimise any risk from injury. Finally then, there's personal protective equipment. So personal protective equipment then would include personal hearing protection or the harnesses that might be used when people are working at height in circus or musical theatre. United Kingdom, the responsibility for identifying and minimising the risk of harm to health lies with the employer or with the person with responsibility for the premises. So it's really important to do a risk assessment, and all a risk assessment is identifying who may be harmed and how they may be harmed, and that's where our physical, chemical, biological, ergonomic, safety and psychological hazards come in, and the hierarchy of control to minimise the risk of harm. Individual performers will want to consider their own vulnerabilities in terms of whether that may raise the risk of them being harmed at work. This would include things like age, sex, ethnicity, any underlying medical conditions, pregnancy and younger performers. If performers have any worries that their work is affecting their health or that their health is affecting their work, I'd really encourage them to contact the British Association for Performing Arts Medicine, where there's a range of clinicians that are highly experienced among several medical disciplines, and they can arrange an assessment and advise further.